want to ask you about disruption in healthcare. How do you see technology disrupting healthcare at this point and in the times to come? Do you think it will solve challenges such as, you know, affordability, accessibility? Do you see that happening now, or is it still to come in the years to come?
So basically, we have founded this organization which is Community Science Alliance, which is a collaborative between academicians, clinicians and community-based organizations working in rural, remote and resource constrained settings, rural and tribal organizations which are going to treat people in the last mile. And what happens is, we as physicians have been trained in our medical schools, which are mostly in urban areas, and trained on best care guidelines, also with all the resources available to us. But when we go into rural India, we realize even for our rural postings, we are suddenly thrown into a milieu where there is no, sometimes there is no drugs, there are no investigations, there is no mentorship, there is no support, and it's very difficult and disillusioning for a young medical student or young doctor to go into these areas and give the best treatment. And for the doctor, the best thing to do is to treat the patient and to care for the patient. So it can be quite frustrating, and this is a lacuna that we realized working with rural populations during COVID, and what the gap that can be bridged with a very low cost and effective intervention, so to say, is that creating clinical protocols which are evidence based but contextualized to rural India and low resourced settings. What we did is, we took the evidence based protocols and guidelines which already exist, and we have contextualized them with extreme labor intensive study of various other guidelines or any kind of literature review from India as well as developing Asian countries, and we have tried to contextualize the pathways to such rural situations where sometimes if you do not have a good guideline on snake bite, or you do not have a good guideline on chest pain, which can be utilized in rural India on poor patients, where sometimes the proper drugs or the first line drugs are not available, or somebody may not be there to read an ECG, or somebody may not be there to help give advice. So we would have that kind of a setup where a doctor going into that kind of environment would be able to treat the patients, given mentorship, given these pathways in different methods. Like we have this content which is now created, it will be disseminated as an open source on an open source website or podcast, or we have a link which they can access on their devices, and that will give them algorithmized method of treating the patients. And then we would also later on support through a fellowship the other things which are required, such as incentivizing them, giving them support in the terms of subject matter experts, as well as giving them training guidelines and updating the content regularly. So this will be a very basic goal immediately, which can cross that gap from a doctor being present in the rural setting to being able to treat in the best way possible. And that kind of disruption is also required, because sometimes we get a lot of technology now which is a supply side, which means that a solution is created, but it is now being matched to a need which may or may not be there, while we are trying to look at a demand side innovation which looks at what is required and what is the immediate need, and then creating a solution to it. So I think this is one of the ways in which technology can help rural India, as well as those who do not have access to care, but also can help the urban poor, because there are many physicians who are treating urban poor who also need these guidelines and also will be able to access them at any time.
Right, right. Are you also creating some sort of awareness kind of campaigns with these doctors in these areas?
Yes, so we are working with 7 community-based organizations like the Mahan Trust in Meghat, Sangwari in Chhattisgarh, BHS in Rajasthan, and Noora Health. Then our knowledge partners are St. John's Research Institute in Bangalore, as well as the Lakshmi Mittal South Asia Institute at Harvard University, Albert Einstein University in New York. And what this whole collaborative is creating is a ready resource and a support for these doctors who are working in those primary healthcare clinics already to field test. It's like a petri dish for us to field test our current content and already developed pathways to see that they work, so that they can be put on a open resource site to be used by everybody. So we are directly collaborating and looking at real real world data coming in from there.
Right. Well, that's some great work that you are initiating. Thank you so much for joining us here, Dr. Charuta.
Thank you so much for having me.